I'm Whitney Dean. You're listening to Talk to the Experts, News Talk 770 with Clarity Laser Vision. Their website, claritylaservision.com. That's claritylaservision.com. Dr. Ahmed Al-Ghoul, who's the director and founder, is in studio. And okay, we learned about touchless surface ablation, or TSA, in the last segment. But there's a lot of other different services that are available, or different options. So first of all, when someone, contacts you and they come in, what does that initial appointment look like? Because you do complimentary assessments.
Yeah, I mean, I think the most important thing that that really made me sort of develop this center of excellence is sort of the notion that, when I wanted to develop this, I really had this belief that I didn't want to compromise in anything that I would do if it was my own family member. So I like to sort of think of me trying to work from the inside out approach, trying to say, well, look, if it was my own family and someone who's interested in corrective eye surgery, what would I put them through in order to feel that we maximize the likelihood they would have a phenomenal outcome? Mm-hmm. And so everything that we've done at Clarity Laser Vision is from that core sort of principle. And so when someone calls in, the first thing that happens is, of course, we set up an appointment. And I do work with a lot of associate doctors who essentially do the first analysis to determine, based on a set of tests, whether someone is even a candidate. Mm-hmm. And then once they're determined to be a candidate, then we follow through with another analysis by me, using another set of tests that, again, sort of go a little bit deeper to, again, ensure absolutely that they're a good candidate, and then also allows me to be able to say, okay, well, now that you're a candidate, mm-hmm. well, which technique are we going to talk about? So it is something that I've always kind of believed in, which is the concept of rule of twos. So I try to always have two of everything that I do from a diagnostic perspective, because I just don't, I love technology, and I know enough, and as you know, like, technologies can sometimes throw us off in one way or the other. But if you have at least two ways to measure a very delicate structure like the eye, mm-hmm. then you have a more predictability and consistency in how you're going to be able to measure. Sort of like the concept of measure twice and then
cut once.
Cut once. I actually try to measure.
Literal.
Yeah, I mean, I actually measure more than twice. I try to measure like 8 times. I mean, by the time the patient comes for corrective surgery, as I'm sitting with them, I'm like, I just want to let you know, I did measure your vision about 6 times. I'm going to do it yet one more time. And mm-hmm. Maybe that's a little bit over the top, but you know what? I think the idea is that the same thing that I was saying earlier, which is like, I got to make sure this is done right, and doing that requires that consistency and repeating measurements and looking at the same structure from different, essentially, bird's eye view. Mm-hmm. And that's where I use various technologies. So basically it comes down to essentially 2 visits. We can sometimes put it all in one visit if someone prefers to do that. But the concept is we want to have 2 sort of ways, 2 different appointments, if you will, that allow us to be absolutely sure that we went through all their questions, be able to answer, any concerns they have.
And people have time to, go home and think for a minute and like, okay, what are the options? Or, this is what it's looking like I'm heading for.
Yeah, I mean, I think at the end of the day is that I feel good to have, fully informed my patient about, the pros and cons and sit and let them kind of think on their own pace whether this is something they want to pursue or not.
Mm-hmm. Okay, so you go into the appointment, maybe 2 appointments, and you're doing the assessments, and they come out the other side, and you usually have options and recommendations for them. How do you go about talking to people about those options, giving them the pros and the cons, the risks, and also the expectations for the outcome at the end as well?
Well, I think this is where having someone who's a corneal specialist helps, because the laser technology is a very, very robust technology, and chances are that you could do very well most of the time, very nicely, with the great outcomes. And you could argue that, look, why do you have to go to that detail? And the reason is because I'm a corneal specialist, so I actually, a big part of my practice is dealing with complications from, say, wearing contacts, from infections to the cornea, from hereditary conditions, from trauma to the eye. So I've naturally become very, very sensitized to the notion of having anything done to the corneal structure. Mm-hmm. And so with that expertise, I kind of want to be able to say, well, look, based on my analysis, maybe there's some hereditary corneal condition that I pick up on because it's a very subtle abnormality. Maybe there's something in the family that is happening that sort of predisposes them to potentially getting problems if we did one technique or another. So that's where we want to sort of use our corneal expertise, in addition to, like I said, my other colleagues who have their own versions of their expertise, and combine that to try to decide, maybe someone is good for LASIK, maybe someone is good for PRK, maybe someone good for ICL. That's a process that requires essentially an analysis that, really I feel a corneal specialist can help fine tune, if you will.
Mm-hmm. Okay, so let's get into some of the different options. We talked about TSA, but then you keep on bringing up PRK, or is that, so which one is that one now? Is that the traditional way of doing it that's been done for a very long time now?
Well, yeah, I mean, essentially TSA is the more advanced version of PRK.
Okay.
But sometimes, I'll give you a simple example. Someone may be having a hereditary corneal condition in their eye, would be better suited if they were to have corrective eye surgery, provided that condition is not a contraindication, through PRK as opposed to TSA. Mm-hmm. There are situations where it is still favorable to actually do the traditional PRK technique, where I have to essentially remove the epithelium out of the way myself, as opposed to the laser system.
Okay.
Thankfully, most of the time, if someone wanted a surface ablation, we can offer the TSA, but as I said, as an alternative, when required, we would do PRK option.
Okay, now LASIK is still an option, and where has that gone now? What is LASIK like now?
Well, LASIK remains a very, very popular option because it's truly a fantastic technology. I mean, I think the thing that's amazing about LASIK is the incredible recovery time. There's no comparison. I mean, if you told me, well, what would it be like in terms of visual recovery, the time factor, there's no comparison. LASIK, I mean, it continues to be the fastest recovery out of all the procedures. It's also,
so how long is a recovery for that one?
Well, I mean, we still like to tell our patients to expect a week to recover. Mm-hmm. I mean, I think realistically, most people recover a lot sooner than that. I'd say that honestly, most people by the next day, they're seeing fantastic. But
wow.
I still would like to sort of prepare them, right? I always like to kind of under-promise, over-deliver, right? I want to kind of prepare them for that week of recovery. I say TSA, expect 2 weeks is kind of what I say. Mm-hmm. And then again, still LASIK, you find that the maximum vision that you would sort of expect is a lot sooner to come than, say, surface ablation in all its forms. Mm-hmm. And that's why I still say, look, I think if you're still interested in LASIK and provided you're a good candidate, I'm very much happy to provide it. But I think what I do, which is kind of unique, is I use, like I said, a lot of diagnostics to try to essentially ensure that there's no risks for them to have something like LASIK. Mm-hmm. And if there's no risks, then I think they would be an excellent candidate for it.
Okay. And what else is there beyond LASIK then for options? I feel like you have quite a few listed on your website.
Well, I know there's a lot of acronyms, and it can be a little confusing, but I think the simple notion is this. I mean, you got essentially, if you think of the eye, it's like a camera. You got a lens that's meant to focus the images to the back of the eye. In our eyes, essentially that lens is really two lenses. You get the cornea, the front part of the eye, and you get the natural lens that's inside the eye. Mm-hmm. So, if you're going to do corrective surgery, you're either going to do it to the corneal structure or you're going to do something to the lens. Mm-hmm. So we kind of talked about the corneal procedures, really. Yeah. Either you essentially do it right on the surface or you use a LASIK technique to correct the vision. Now, when it comes to the lens options, you got essentially two techniques there, too. Either you could put a contact lens, believe it or not, inside the eye that sits on top of the natural lens, or you actually replace the natural lens with an artificial lens.
Wow.
Yeah.
And that lasts for a long time? That's permanent?
Very long time. In fact, I think I would say that, all the options are great, but I think when you look at essentially RLE, which is if someone has cataracts, you would say cataract surgery. I mean, if someone comes in with cataract surgery, you do their surgery, their outcome tends to be almost, I would say, permanent. It's rare that it changes drastically over the years to come. The ICL, which is that contact in the eye, is again a great option, and it would last a very long time. But you have to keep in mind that when we talk about permanent outcomes, I mean, our bodies are not permanent. They're constantly changing. So, when we are trying to deliver a great outcome for our patients, we want to make sure we set the right expectations. So if a 20-year-old comes in and says, I wanted corrective eye surgery, and let's say they're high myope, like -10 or more. I mean, first of all, that's someone who maybe is not a candidate for something to be done on the front of the eye. So then you could consider something like the ICL, which is the lens inside the eye. I'm sort of giving an example of a case here. And then let's say they move on in life, they have a great outcome, and then when they hit 40, now they're suddenly finding that they have to use reading glasses. And that's just the natural part of aging. So we have to have that discussion with our 20-year-old, say, look, when you hit 40, you would have the same issue that every other 40-year-old is going to have, which is, the reading glasses.
Yes.
Now, could we do something for that? Potentially, and we could talk about that as well. But let's say go another 20 years, right? And then now they're 60 years old, and now maybe they're talking about cataracts, because cataract is a natural change that happens in the eye. So I think the important thing I want to sort of bring out is essentially we want to provide that peace of mind in terms of visual outcomes to address a problem that someone has. But in terms of whether it's going to get rid of their need for glasses forever, I mean, I think the reality is that eyes do change, and that we have to sort of set the right expectations. Say, well, look, if you don't want to wear contacts anymore, you don't want to wear glasses anymore, great. You're 20, you're probably going to have good outcomes for 20 years. But when you hit 40, you got to expect that you're going to need some reading glasses.
Yeah.
Until maybe there's another technology we could talk about that.
So then how do you, for then people afterwards, you do follow-up though, don't you, for a while afterwards? And you do recommend for people to, still get their vision checked. Like, it doesn't mean that you should never have your eyes checked forever again.
And I think that's the thing that we really try to harp on, which is the concept that, we're trying to move away from the concept that, look, we get it, corrective surgery is heavily advertised, and in some ways, you could argue it's seen as a commodity, but we try to say, look, it's a service, and as a service, you need to ensure that you kind of invest in maintaining that service.
Yeah.
Because your eyeball changes. There's other things that happens in the eyes, and that's why I think the primary eye care provider, your optometrist, or if you happen to have an ophthalmologist, your primary eye care provider, I think they're an integral part of your eye care for the years to come to take care of your eyes, whether you go for corrective surgery or you don't. So we like to always, ensure that there's a follow-up care that's being developed. We like to sort of recommend that the patients come back to us as well to check maybe on every 1 to 2 year basis to ensure that, our analysis suggests that they have still great outcomes. It's sort of like, you're investing in a let's say you get a nice car, or you get something, and you want to be able to maintain it, right? You have to be able to come back and ensure that everything is well taken care of.
Yeah.
And in return, what we're saying is, look, I mean, we understand you made that investment, and provided it's safe, and provided you continue to come back for follow-ups, we will honor this sort of commitment of a lifetime commitment for your, if you ever did need a touch-up laser, we would be able to honor that for you for life, provided that it's, again, safe, and that you maintain these regular follow-ups to ensure that, nothing drastically changes where, if someone says they get corrective eye surgery, and this, by the way, does happen a lot, like people get corrective eye surgery, and then they just, some patients say, well, look, I'm good now, I don't need to see an eye doctor. And they come back maybe 10 years later, and then maybe something else happened, right? And then you're thinking, well, if I have seen what happened maybe a year or two later, maybe I would be able to, help them out more, right? So that's why I think it's important that we want to instill the concept of continuing your care with your eye care provider, and not think of it as a commodity that sort of rids you of not just glasses, but even, eye care altogether.
Yeah. Talking to Dr. Al-Ghoul from Clarity Laser Vision. You can find them claritylaservision.com about corrective eye surgeries and eye care that's available. 587-317-1809 is the number, 587-317-1809. He's also involved with another clinic as well. We'll talk about that, where the cataracts, surgery, ophthalmology. Oh my goodness, big words today. Transplants. We'll talk about that in just a moment as well. I'm Whitney Dean. You're listening to Talk to the Experts, News Talk 770.